First, I would give you an update on what is happening global. We at 1.3 million confirmed cases, 73 deaths. Massachusetts, 13,837 confirmed cases, 260 deaths. And in Brookline, as of 4 p.m. today, we have 77 cases, 166 people are quarantined, 34 people have been released from quarantine, 28 has been released from isolation. And we have a new category, which I call suspect cases, because we have known for a lot of people are not being tested, but they fit the clinical definition of COVID-19. So I created a category to capture that. Um, and I think that would give us more in-depth knowledge about the transmission that's happening in the community. So,
How many suspected do we have?
well, I just started it today. So, um, one person I know of that was not tested, but they PCP told them to isolate because they fit the clinical definition. And that has happened a lot. Usually we don't track that, but I want to actually, get more grasp of what's going on in the community overall.
Right. And has Brookline had any deaths yet?
No, but I have been working closely with nursing home in Brookline. I'm taking the lead on nursing homes, assisted living facilities, um, any type of senior living facility, and BHA housing. So even though some of these are under the purview of the state, I am the contact on the ground instead of Barbara, and working with them in terms of doing the investigation and follow up. Just because I think it needs a little bit more hands on. I don't, not to say I don't trust the state, I do, but I want to know the grasp of the situation that's going on and how much I can help the state and aid in any way possible. So if it if it comes where we have to move people from a facility or provide additional testing, I definitely want to work, directly with the state. We have 9 people doing contact tracing. Look to add a few more from the schools to help, because I understand the state is almost overwhelmed, and I don't want the staff to be overwhelmed. So I still want to have some play in this. But I'm looking at 2 people online that could possibly also help with some of the contact tracing. So I will be reaching out to Pat. I know you one of them, and Dr. Moya as well, that can assist us on the ground. Because I think that's critical. My goal in the end is to at least have 15 people that can be epidemiologists on the ground and would be very critical moving forward um, as the cases begin to increase.
And did you say you are using some of the resources that the state is doing with the school volunteers, the student volunteers?
So I'm using the school nurses. So 2 of them have been a great help on the phone. I have used 4 total for contact tracing and hope to train a few more. The health department, because we have had several employees, not in the health department, but around town, EOC operations has totally moved to virtual. As of today, the Brookline Health Department would move virtual at least Tuesday, Thursday, and Friday. I've allowed the building to be open for employees. Monday and Wednesday can drop in at any time. But I'm more focused on creating that separation, and making sure people stay home, wear any type of mask, whether it be a bandana or something over their face, because I don't think it's enough to right now to practice social distancing and wearing a mask. I think actually the message should be more of staying at home. And so that's something that I've I will drive over the next few weeks. And I'd be remiss if I didn't say this, but happy Public Health Week. I appreciate everybody for um, volunteering, working after hours after you're done with your day job. Now you have to deal with me at night and listen to some of the boring things I'm going to talk about. But I definitely appreciate the hard work that you have put forth, and I couldn't appreciate you enough. So hopefully, once this is all over, we can celebrate Public Health Week over an adult beverage or something.
All right. Might be next Public Health Week. All right. So you wanted to talk with us about quarantine.
Yeah. So I've had a conversation uh, without naming the entity, but there are a few senior living facilities that want to quarantine the building. And I think some of this stems from the amount of deaths that happened in Revere. I think they did a quarantine the building after there were so many deaths in a senior living facility. And so, at first I struggled with quarantine a building, especially people that from a clinical sense are healthy and they have not been exposed to COVID-19. Um, but I think we should have some discussion in terms of what would be a trigger to quarantine versus what is actually a trigger for quarantine a town. And and with that, should we be thinking about, because in our mitigation plan, we have some of the triggers are set at 250 cases. If we need to do um, a curfew at 6 p.m., and I think we need to have that conversation now as we look toward more progressive measures, because what I'm noticing in the community, the mitigation efforts that we have put forth that's not working. And so I could just give you a few examples. I've sat outside a few businesses um, at least about an hour. And one business in particular, there were people walking through the doors every minute to 2 minutes. So I think, some of this is non-essential, but let's just take the business out. We have more people. I walked around within a 10-minute period. I saw every minute there was 12 people on the street, and I counted 12 different people. So everybody's either bicycling, skateboarding, um, running, walking, mask, no mask, etc. And I don't see that that is going to change anytime soon. So I expect our numbers to continue to rise just because people are not taking it serious enough and staying at home. And so we have to have some trigger in terms of if we quarantine the building, whether we have deaths or too many cases in the building, versus when do we say we might need to quarantine Brooklyn. So I open it up from there.
So could you just be, when you say quarantine a building, that means nobody in or out of the building?
Correct.
And so if this was a nursing home, I mean, staff have to come and go, right? And obviously food deliveries have to come in. So again, there'd be some essential movement. And don't most of these nursing and assisted livings now have no visitor policies? So,
So this ticket, so one of the calls I got wasn't assisted living, it was senior living. So it's a regular apartment complex with seniors. And people are afraid that because COVID, you know, there's a high fatality rate amongst seniors, they want to protect seniors and not have the entry of outside people to contaminate the place, nor do they want seniors going outside the living quarters,
Yeah,
outside the building, and bringing it back to the community.
yeah. And do you have the authority to do that to an individual building, like a senior housing building?
So, yes,
Right.
but I wouldn't want to do that unless there were a significant amount of people with COVID and a certain amount of death.
Yeah.
So it would have to be deemed an infectious site, sort of dealing with what happened in Seattle at the nursing home, where it ended up with 37 deaths.
I'm, I mean, this is a hard one. I'm wondering, is there an intermediate step? Maybe the senior housing buildings have already done this. My mother used to live in one of the Brookline senior housing, so I know them pretty well, um, where they should have a no visitor policy, but even though it's not a medical facility.
So
But,
I would tell you which facility it is because I think it's public knowledge anyway because they sent a letter to the select board. Um, it's 112 Center Street. Um, yeah,
yeah.
Hebrew Life. It's owned by Hebrew Life.
So could there be a no visitor policy, but the residents themselves would have freedom of movement? They would have the right to go to the grocery store, obviously, like the rest of us.
So what they did, they put let me see if I can grab the letter because they took some hard language because they quarantined the building. So I explained to them exactly what quarantine the building means. So their letter, it essentially says this means that you not leave your apartment unless you have an essential offsite medical appointment or another critical reason that we ask you to discuss with us prior to leaving. With our strong preference is for you to avoid going outside. We recognize how important this activity is to many of you. If you do venture out, please walk alone. Do not socialize within 10 feet of another. Do not go into any stores or any other place of business. Act like you have the virus and wish to help others safe. So essentially, what the communities of Brookline have done, they make sure that everybody's food is ordered for them. So they do all the grocery shopping. They all the medications come to them. They sanitize the mail once a day, so you get the mail the following day. They take temperatures of every resident when they come back to the facility. They take temperatures of all the staff. But the issue initially was they wanted to use the word quarantine of the building, which that has some significant legal connotations that I did not want to get into because what do you do if you quarantine the building and somebody leaves? And I mean, because legally that means you might have to arrest them,
Yeah.
which that wouldn't bode well. Um, but the other aspect, I understand the fear. So at one point, do you quarantine the building? And at one point, if you quarantine the building, um, at what point do you actually look at quarantine a town? Since we know New Rochelle has done that, and I think this might be far ahead of anything, but I don't think we should not look at it and be futuristic and thought process.
Right. But given what's in place now, the letter you just read us, um, assuming, and this will probably happen, there will be cases at a building like 112 Center Street. Um, Most of those are apartment, their studios or one bedrooms, I think, and one or two people in each one. If there were cases in a number of those units, why does quarantining the building protect people any better than quarantining the units that the sick people are in? Well, I guess it's you'd be isolating the apartments that the sick people are in. Why would it be necessary to quarantine everybody else? Um,
Well, the only way you would, I guess the rationale would be quarantine, and I could open it up for anybody else to make a thought process to it before I respond. Gretchen, I'm sure you have a thought. I am positive.
I was just curious if we know if we have any clusters in Brookline where we know cases are coming from, or if it's kind of throughout Brookline. Do we know that information?
Not have clusters. I did have a GIS map done, and it's everywhere. We're surrounded.
Yeah.
And we'll get to this part later when I'm talking about upping the ante in terms of protections for workers at some establishments. I mean, we are now starting to see workers at different food establishments, become positive for COVID.
I guess, we were going to talk about the food changes, and I looked at what you sent out, and I like those. But I'm just thinking, it seems to me that we know it's already in Brookline, and as you said, it's distributed throughout. We know it's in all the towns surrounding us. It's probably, at this point, higher in Boston per capita than here, although I don't know that for sure. I'm just wondering, closing borders isn't what works. It's isolating people who have it, quarantining people who we know are exposed. At the level of the building or town, my sense is it's so widely distributed already that any of those boundaries are artificial ones. We're going to have sick and well people on one side of the quarantine boundary and well and sick people on the other side, and we're not protecting anybody from anybody else. Unless it's you're ramping up the contact tracing, and I would sort of say we have to do that at the individual level. You have the disease, you're isolated, we know you've been exposed, you're quarantined. I guess I'm not persuaded that building level or town level, with the disease already so widely distributed, is going to do any added good. I don't know if other people have a sense of that.
I think I'm unmuted. Can you hear me?
We can hear you now.
Okay, sorry. I mean, I think the other issue with 112 Center Street and the senior living is it's easier to have prevent people from leaving from those places, but there are a lot of people that come in to help them, like home health aides and medical people, nurses, homemakers. And so I'm just wondering, like with a quarantine, how would that be handled? There are more people coming in than people going out, usually in that kind of living situation.
So it would be handled just like, what's in our mitigation plan. Let's say, for instance, and I hope, I pray that we're not faced with this, but let's take the arbitrary number of 500 people in the building. And 100 of the 500 have COVID. Ten deaths. So what I think I want us to move toward is, what's the trigger for the Board of Health to quarantine a building? Should it be based on protected mortality? Should it be based on ensuring everybody is protected and the debt doesn't rise? Or should it be based on just a protective factor overall? And if the answer is no, we don't need to worry about the protection because it's widespread, or at 1%, at what percent do death become a trigger to quarantine a building, a town, etc.?
So the people who are the greatest risk are the people who are living in the building, more than the people coming in, although anybody can. But the time to protect the people who are living in the building is now, right? When there's, I mean, I'm sure it's already in there. There's going to be some people who are going to get sick in the next few days or weeks, but it might be relatively low numbers, and we isolate apartment by apartment. I think Patricia's point is really a good one, that the thing to do now is really, if there's ways to limit the people coming in. I mean, people need their home health aides and they need food deliveries, but if we can, and I don't think temperature screening works all that well anyway, right? Because so many of the people who are carrying it aren't sick yet. But the thing to do for Center Street now is to say the number of people who come in have to be an absolute minimum. Home health aides that are there for convenience but not necessity, should not be coming in. Once it's in multiple apartments, the only hope is that the people who have it stay in their apartments and don't move apartment to apartment. But the boundary between the building and the rest of Brookline is no longer protecting anybody. So I'm still struggling with, again, now's the time to do what we can to mitigate. But I just don't see at what point a quarantine across a boundary that other than an individual person, an individual's apartment, really protects.
Right.
I'm curious if anybody else is, I might be seeing it wrong, so I'm looking for other people to weigh in.
I'm Gretchen. I'm looking. You look like you have a thought.
I'm not exactly sure how to approach this. I don't know if there are any existing guidelines on this type of, if there is some sort of tipping point or ratio that people like to look at. I don't know if that exists. I haven't looked into it. But I agree with some of Tony's concerns on having, how are we thinking about, isolation within a particular unit within this building versus the building itself? I don't know.
I mean, it might be something to, I've not had a chance to research it if there are any guidelines. But again, I think my experience of watching this epidemic is every effort to shut a boundary has failed. Because again, the disease is already on both sides of the boundary before the shutdown happened. That's happened across countries. We tried to do that with China. It happened with New Rochelle. I mean, I don't think, I'd be surprised if there's any evidence that the New Rochelle quarantine actually protected anybody either in the town or out of the town. And I just feel like the same thing would apply to a building.
Well, let me ask this, because I do remember New Rochelle actually, they had, what do you call it? They blocked the town,
Right.
a containment zone. So that was a form of suppression. You couldn't leave. So everybody that was in the town was sealed in the town. And I think it's out of an old movie of Outbreak. If you were going to die, you're going to die in the town. If you're going to be contagious, you can't leave. You can't spread it no further. So I think in that part, that was a part of containment. Just like in China, they did effective shutdown of everything, and you were contained in your home. So if everybody was going to get sick, they became sick, but it couldn't spread no further than your home. And I think when you look at a building, if you shut everybody into their room, whether they isolated or quarantined, into their room, they can't go outside their room, then you effectively contain it in the room and it doesn't spread throughout the building. So whoever's sick would be sick and it can't spread to the rest of the building. And if you do an effective shut-in for 30 days, you have allowed for the cycle of the disease to pass. Sort of China's method.
That makes sense, but that again, I think that makes sense at the level of the individual person or the individual unit.
Yeah. But in that case, they wanted to make sure nobody left their apartment, nobody walked around
Right.
within the building or outside the building. Now they actually they loosened it a little bit to allow for that to occur. In essence, it wasn't a bad idea because at that time, well, it was a bad idea in the sense that there was no cases. So now you quarantine healthy people. So the terminology probably is a little bit off because it's the wrong terminology to say quarantine. Maybe it was more, let's do a shut-in. But that still, begs to differ. If it ended up where they had to do something to quarantine the building, which was in Revere, and it was at one of their other properties, is the reason that this came up anyway. I think it was 7 deaths, 6 or 7 deaths at the facility in Revere.
And I would be tempted, I would like to actually research a little bit whether there's any evidence from any other jurisdiction that a building level or a town quarantine works and under which circumstance. I might have some time to do my own research. I don't know, but you would think that at the CDC, there'd be somebody looking at this or somebody modeling this. We're flying a little blind.
Yeah. Yeah. The best that I have seen is the mitigation plan, but that's more or less strategies in order to mortality. But it's not a trigger to say, yes, you need to quarantine or you need to isolate a town, et cetera.
Well, I'm willing to try and spend a little time doing some research and asking the experts that I know if we need another meeting, but I can at least send you, anything that I find out. My personal bias, and again, other people please weigh in. I know it's not a personal bias. My thought is at this point we should be moving to as aggressive, individual, the contact tracing, the case finding, and aggressive isolation and quarantine at the individual person or unit level. And let's see if there's evidence for building or town before we advise that you move that way.
Yeah.
Does anyone want to push back on that
I haven't heard Peter say anything or David say anything yet.
My voice just come through?
Yeah, we hear you.
It's through now.
I'm not sure enough of the whole science to be able to comment. I mean, I'm listening to the arguments. I'm not even, quarantine means nobody in and nobody out, but then we said, as Pat said, and I can see this, all the delivery people, all the extra health aides. So I think there are intermediate steps which you could suggest. We just did suggest them. Nobody goes in or out that's not absolutely essential. But there still are lots of opportunities for the virus to enter into the facility. I'm not, who asked for the quarantine? The residents of this building?
So it was the executive staff at the Center for Communities.
They wanted to do it because they think it's the best measure to keep it from spreading further within their building.
Yeah, so they didn't have a case, but they wanted to draft a letter. And
they were ready to go when they get the case.
Went to some of the residents in a robocall, and it came to my attention because one of our staff actually lived in the building. And at this point, I said, okay, they used the wrong language. That's not good. But the second part is that you have a lot of people, there's a few people with mental health issues that I didn't feel as comfortable with saying, using the word quarantine. There were people in the building also that either were Vietnam veterans or might have survived the Holocaust. So when you think about, it just struck me the connotation of the word and the use of quarantine. That could be a trigger for PTSD. But I understood the intent because of what happened in Revere. So, I've worked with them over several days to tweak the language, but then it brought to light that maybe we need a broader conversation on what exactly is a trigger to quarantine a building, and what exactly is a trigger to quarantine a town. Because I would assume at some point, New York had to say nobody can leave New York. My military unit, 143rd Air Wing in Providence, has stood up to take over all military operations medical, and they were stopping people from New York from coming into Rhode Island. And actually screening people.
My license plate, yeah.
Yeah. So, that I just think, and I see people making these decisions, but I don't know if it's science-based or evidence-based.
There
I
may
think some of
be,
these decisions we need to offer support.
there may be some benefit to the rest of the world if you have a hot spot and you contain people in that hot spot, but it doesn't protect the people in the hot spot. Right? I mean, so telling people they can't leave New York when New York, was having dramatically higher percentages of cases than the rest of the world, that I think the intent was not to protect New York. It was to keep New York, from infecting other communities. That may or may not be too late. But the people who were most concerned about dying from this are elders. They're the ones in center community. If we quarantine them in after the disease is running through that building, we're not going to protect them at all. So, again, I think the time to protect them is now. I think what you and the building together have done in terms of aggressive, voluntary, stay in, don't let people in who aren't necessary, is pretty good. And the rest should be based on known individual exposure or disease. And that's when it's a true quarantine or a true isolation. Again, let's research it to see if there's any evidence that we're missing about setting up those boundaries will actually make a difference, either for the people in the building or the people outside of it.
Yeah, I can imagine being a non-COVID patient in a facility that's now quarantined with everybody else around me developing cases, and I couldn't get out. I don't know, it'd be a hard position to be in.
Yeah, and who's being protected in that case, right?
Everybody outside of the building.
Yeah.
I have a comment. I wonder if there's also a place to really do some education and support at the Center Street complex, just in terms of how people can protect themselves and to make sure that the people that do come in are wearing masks and, washing their hands and all that kind of thing. Because it seems like there's quite a bit of anxiety in that housing. And I'm sure it could just amplify with people talking to each other and starting to get very panicky.
Yeah.
Somebody who could do that kind of thing.
So we have provided them with a lot of information, but they have actually done a lot.
Good.
They also run the R3 program through the facility. And so they do a lot of work with Harvard.
The other thing, I know that you were reluctant to use student volunteers for contact tracing because, you have to have people do it right. But I'm wondering if there's a role for student volunteers, like almost a buddy system. Um, Obviously, you don't want them practicing, mental health clinical work without a license. But, anyone who wanted a call twice a day would sign up. And the student would call and just say, hello, are you okay? Are there any things you need from outside that we could pass on to the town? Just reminders about social distancing.
Like a wellness check, sort of. Wellness.
A wellness check, and if we could get mobilize some student volunteers to do that.
Tony, is that the Public Health Volunteer Corps?
I believe so. Yeah.
Yes. So I have two students. I talked to Dr. Nate Willis, who was the lead for that. He's activated now. So we do have two students from Harvard, and I'm going to add a few more to help with contact tracing as well as several other things.
But I know from my students, again, I assure the state, they got something like 1,200 volunteers, and it's probably going to take them, weeks to deploy everybody. But there are students sitting around waiting for something to do. So,
Yeah. So I'm going to try to plug in.
There might be unintended consequences, but it might be worth something to put together. All right.
Yeah, I'm looking at it. So hopefully tonight, I had a few professors email me. I'm going to try to get through my emails tonight and respond. Some more people on.
Is there anything else on this issue, or should we move to the next one?
So Tony, will you do us a favor and share whatever literature you have around whether or not, or what works? I
won't be able to discuss it with you, but I'll send you what I find.
That's all. Good.
We can discuss
I think
it.
we could put it. I think we could put it on the agenda for the next meeting.
Good.
And if you send it to myself or Devin, we can just send a blast email to everybody so they can be prepped for the next meeting.
Okay.
Okay.
All right. The food advisory.
So I'm gonna just do the food advisory. So I've seen some concerning items or areas in Brookline. And so for the last 3 or 4 weeks, I've wanted to put out a food advisory. And so I've emailed the food advisory. So I would just go through it and we could discuss it. Effective April the 7th, all food establishments deemed essential under the state order dated March 31st, 2020 must follow the following requirements. All staff must wear protective masks, gloves, eye protection during service and establishment. All establishments are required to have temporary plexiglass as barriers. All entry doors must be posted advising customers that social distancing must be maintained inside and outside the establishment. Each establishment must increase employee illness surveillance. That includes making sure that the staff have not been exposed to COVID. Employees, if an employee has any illness or symptoms, they need to ask that question. They need to take a daily temperature reading of employees before they start their shift. And the surveillance must be recorded by the staff, noting employee and position. Establishments that are offering takeout service, we request that they do contact-free method of sales. Contact-free sales invoice, having customers order and pay online or over the phone. This must be placed in a pickup location at the entry area of the establishment. Curbside pickups are optional. Food service delivery. Advise the customer you will be doing a contact-free delivery. Take full payment, including tip, online or over the phone. Receive directions for where the customer would like their food placed. Delivery staff must wear protective masks, gloves, eye protection. Delivery packaging must stay closed, sealed. And all pens, swipe card devices, portable delivery holding units must be wiped down and sanitized. So this advisory is essential because what I have noticed is that, and there's several establishments, but I will start with Stop and Shop. So Stop and Shop, there was always a line, and a lot of people in the store. They were not social distancing. I did talk to them, they corrected. Star Market, same thing, but not, it wasn't as hectic. Trader Joe's, they have 100 people in the store and 50 people, 30 to 50 people in a line. There was one person going in the store almost 1 to every 2 minutes. This has been happening since almost 30 days now. And I don't see the necessity for these stores. First of all, everybody should be shopping for 2 to 3 weeks. What I'm finding is people are shopping every day. When CVS every day. Nobody is wearing protective masks in terms of employees. There is consistent mask usage. That includes Dunkin' Donuts, Trader Joe's, whatever establishment it is. In the last week or two, I have noticed, including Whole Foods, a number of employees now are tested positive for COVID-19. We probably didn't act fast enough in protecting employees because these are essential businesses that we said they can stay open. And now we're slowly depleting their staff because we haven't put in effective measures to protect them. Or the public. One of the other thoughts I have is that maybe we ought to reduce the amount of hours these operations are open. Maybe we need to effectively stop the line, even though it's an essential business. But I just predict that this would be the new hotspot because people are in close contact. I noticed somebody this evening or this afternoon, they were handing out sanitizer wipes at the door to every customer going into the facility. And nobody had masks on. At least the worker did not. But you're having a hand sanitizer within a foot. Yeah. And so, I just find that this is a serious problem. It's a serious problem.
Serious. Do you know public safety? Have you watched the police officers? They're not wearing them. I talked to them, but they're not wearing them.
Yeah.
And they're supposed to be setting an example. They're supposed to be enforcing it. Somebody, where they should be, at least speaking to people.
Well, it hasn't become mandatory for first responders to wear masks because they would burn out of them pretty fast if they did. We don't have enough stockpile for that. And they could probably practice better social distancing, because they have separated themselves and there's only one vehicle per person. Mm-hmm. But people going into grocery stores, they're in line, and I talked to a town employee, and I tracked their movements for over 2 or 3 week period, and so I began to question. So what do you do on a normal basis? And I've heard this several times. Well, I don't go any place. I haven't left the house in 2 or 3 weeks. So when is the one time that you left your home? What occurred? I went to either go get takeout. I went to the grocery store. Okay. Well, that kind of narrows the field. Whole Foods have 2 people tested positive thus far. So I called every large grocery establishment today and told them that this requirement for wearing masks, gloves, etc., it's mandatory now, based on approval.
Are we taking out those employees who are exposed? Are those quarantined now, or are they still working? The
Oh,
people who work
no.
side by side, but
Once you test positive,
no, not the people who tested positive, but the people who are working side by side with the people who tested positive. Are they being quarantined? Are they being considered close contacts?
yeah.
Yeah, they are. Okay. Yeah. I mean, I think you have to do this kind of thing. I think most of what you have here, probably all of it, is right. I wonder if we should also add that they should put up, they can't control what their customers do, but I wonder if included in the guidelines for the stores is they need to put a poster outside that says customers should
Yeah, they could.
wear a
Second
mask,
that. I would second that.
wear a mask, stay 6 feet away from everybody else. Either wear gloves or wash your hands immediately before coming, after leaving. But the other thing that people probably should be doing is after they get home with their groceries and they've taken the stuff out of the outer wrappings, remember to wash your hands, right? I mean, the packaging that they carried out was handed to them by somebody else. So,
Well, the first thing they probably should do is take their shoes off outside the door. Should they sanitize the shoes?
Mhm.
And make sure they sanitize the doorknobs they walk in. Make sure they set the groceries down, unpackage it, clean everything, wash their hands. If they have a mask on, take the mask off, fold it. You know, that's just
Well,
not
that's true, but we're at an earlier stage where we don't even have a buy-in from a large sector of the people. We need to educate more. We need to somehow collectively get people to do it. I think we have to be firmer. We got to be more of a Cuomo than a whoever. We got to be fierce, formal. Tell them can't do it, and the cops should at least speak to people. I'm not asking if they arrest them, but walked up to them with their own mask on and their own gloves, saying, "Hey, listen, guys, this is serious. This could be your grandmother dies because of this thing." That's what I say to them. It works. I mean, they at least look at you. It's not so unrealistic. Look at TV every night and see other people dying. So I think I think we should think of lots of ways to educate through social media, whatever, in the town more. It's not getting across.
well, I think Dr. Schloff brought up something good earlier is maybe I need about 5 students with the signs just like they use for TurboTax or if you want to buy a home,
It's
have
fine.
big signs and it says, hey,
Corner.
you got your mask? And it doesn't necessarily have to be a traditional surgical mask. It could be a bandana or something to cover the nose and the mouth and glasses. But I think that'll be some effective messaging. But also, I would like to, um, if they see somebody on the street, you know, have a sign to say, "What you doing right now? Is it essential?" And a question mark, just to give people thought. And then maybe the next one say, "If not, go home."
I have a suggestion. On your recommendation for the entry doors, that people should retain social distancing. I think that a mask should also be included there as something, you can't demand it, but you can certainly recommend it, because I've noticed at the parks, we have signs about how to stay safe and social distancing. But on those signs also, we don't have anything about masks. And I know that's because it's just a recent CDC recommendation, but I think the word's not out there yet. And I think it's really important to get it out there.
But I've been wanting to put something out there for almost a month. But initially, the feedback I received was there was not enough masks. But so my quandary with this is, well, it don't make sense for CDC to say you don't need a mask. But on the other hand, we saying that asymptomatic people are transmitting. So,
but now the recommendation is the mask, and for people on the street or in establishments or not medical, a non N95 mask is acceptable. So, and I do think the entry doors to the grocery stores and drugstores, are actually the place where most people are failing to do the social distancing. So I think that it would be very effective on those signs, advising 6-foot separation and also advising, please wear a mask, or if you do not have a mask, scarf or bandana over your mouth and nose.
I agree. I would incorporate that.
And they should probably wash their, use some kind of sanitizer when they walk in.
I think that was the
I
point of
think,
the sanitizing wipes, but unfortunately, the person had to get within so many feet to get it to them. It was a nice gesture,
Yeah, right.
yeah, but no, yeah.
No,
but I was like, I think I need a
it's-
picture of this moment.
I think people should watch.
Just a quick question. Do we know if the larger grocery stores have like an appointed health committee or someone like that where we could gather those people together to agree on some things or do some additional education? Because I think if people are going to be wearing masks who are working in the store, we want to make sure that we help them use all of that equipment correctly so that it's being somewhat effective. Because I could see making this and hoping everyone actually goes through with it, but then many of the people not actually using some of these things in the best way possible. So is there a way to connect with these grocers? Is there any committee among them or anything like that?
I can't remember if there's a committee, but we have talked today. Me and Pat talked to every manager on site. So, from what I do remember, they have always had somebody in government affairs, at least for a large chain. And if there was anything health related, those were the people to help implement any policy changes. So that can be another avenue, especially, I was shocked by one entity that said, yeah, we have done everything you required us to do or going to. And I arrived at the place an hour later and they had not implemented. And so I think we're gonna run into probably more people taking individual responsibility, more so than I think the corporation.
Yeah, I was also at the Star Market on Com Ave a couple of weeks ago, and over the announcement, they played every maybe 10 minutes, like according to the CDC, and they did this whole message about how far away you should stay and some other kind of basic health information, and it just played over the loudspeaker. It was quite interesting. Can we make people do that?
I don't know if we can make them do that, but we could definitely recommend. That's a good idea, though.
So I think all the stronger the message, the better it is. The one thing I'm a little concerned about, Dr. Jen, is when you mentioned that you might want to limit the hours, because I would think that would be the wrong thing to do. I think you want to extend. Don't have fewer hours, then you have more and more crowds.
Yeah, I agree.
Yeah. That was one of the tactics that I saw Italy use. Once they begin to have a significant amount of deaths, I think they realized quickly that there was a lot of people visiting places that were essential, and there was a lot of overcrowding. And so they were the first to begin to implement the 6-foot barriers and the reduction of hours, et cetera, to try to curb the amount of deaths that was occurring in Italy.
Right, but I agree with David, doesn't the curtailing hours just encourage more people to show up at the same time? That at some point, there might be a week where you even close the grocery stores altogether if it gets terribly, terribly bad. And hope that most people have been shopping so they have a week's supply. But if they're essential and they're open, the longer their hours, the more people can spread them out. I mean, I think wonder if the thing to do is to do like we did is anyone else old enough to remember the gasoline lines? It's like you went to the gas station on Monday if your license plate had a 1 or a 2, and on Tuesday, and that we almost, I don't know how in a free society you can create that for the grocery store. But you want to spread people out over time, not concentrate them.
Me and Gretchen, we wasn't born at that time, so we laughing.
I know, okay.
And Devin, we like, you mean you had to have one of your license plate to go get gas?
Well, I lived in New York and I didn't have a car, but
Yeah, I, I think what we will see, and it might not happen in Brookline, but I mean, we could anticipate how it's going. The essential business we have left open will become hotspots for COVID-19. So at some point, if it's not Brookline, there's going to be an entity that's going to have to be shut down because COVID is widespread.
that would be among the employees.
Correct.
Yeah, no, you're right. I think that, so now's the time to get those employees wearing masks and gloves and putting up those signs asking the clientele to wear the mask as well. I don't know if gloves make sense too. Um, people don't know how to take gloves on and off properly, so they end up just contaminating themselves anyway.
It happens a lot.
One thing that we're doing in Maine grocery stores, according to my son, is trying to have people shop as little as possible and instead having people call in or shop online, and then the grocery employees would do the shopping and put them like a curbside pickup.
Yeah.
So that really, decreases the number of people in a store and protects the grocery workers. But you have to call in your order, which is tough.
Yeah, and some of those are 5-6 days out now because that's good because people are doing it. Yeah, I also wonder, I don't know if we can require that of people, but urging delivery for CVS delivers, right? At least prescriptions. I don't know if they deliver other stuff.
They deliver other stuff.
Yeah. So, if we're asking people, these places to post flyers, maybe the flyer should include a next time consider delivery. It keeps you safer.
I think that's a good idea.
And the employee is safer too.
Well, I firmly believe that, we're trying to be a little more progressive. But I think as some of these businesses start to feel what's going on, the impact, then they would adjust, their decisions based on it. So this is the same thing we begin to notice in the healthcare sector, because you had to have 2 negative tests before healthcare could return to work. Well, essentially, once you're depleted, then maybe, you saw a quick change from CDC. If a person was 3 days without symptoms and 7 days from the onset, symptom free, they could return to work. I think you'll start to see some of these policy changes depending on the impact of the organization that COVID has.
The other thing is that these places must be getting deliveries. So, and we have less control over that. We might be at least urging our businesses to ask that their vendors who deliver to wear masks during their delivery time. And just extending it out one more layer.
Yeah, I agree.
I can imagine if this got bad enough that the supply chain for food gets interrupted, and that would be a nightmare. Too many people in that business get sick.
Yeah, that would be. Okay. The last thing I have is the public ways. There's been ongoing conversation in Brookline by different town meeting members to expand walking areas for not only pedestrians, but for more bicycle traffic. And so, one of my concerns about that is once we begin to expand walkways, people are complaining or they're making suggestions about removal of cars besides major stores, making sure there's more walking space by Trader Joe's. They also looking for different ways parking lots could be opened up, more people can walk, have access to Anderson Park, Lars Anderson Park, but just open it up so people have more place to exercise, walk, bicycle, expand the walkways, expand the public ways, expand. And so you can anticipate what I'm thinking. Why would we expand? If we expand sidewalks, walkability, and I know Cambridge is exploring this. If we expand just places for people to exercise, walk, bicycle, are we not inviting more people to be out in the public, spreading disease, etc.?
Well, I mean, I think all those things should be expanded, but not right now. They should be expanded. Any other time would be great for public health.
Right. Yeah, I mean, I would say, what evidence base are people thinking is out there? Is the intent to widen things so that people who are walking have an easier time staying 6 feet away from each other?
That's the ideology.
But again, I think you'll see the same psychology as happens when you build highways. The more you build, the more congested they get because the more people feel invited. I think your instinct is correct. And even if there were in small ways of, we don't know, we have no evidence that would be true. We don't have, two things will happen. Yes, we might give more room for people to make it easier for them to stay apart, but we'll be inviting more people out. And there's no evidence to suggest which one will weigh in more. So for us to to do that as a public health action, I think would be a mistake.
Except one pro to it is that people could commute on bike or walking more easily and avoid the T.
That's,
I think a lot of people want to do at this point.
yeah, people should, yeah.
And if they could bike safely, I think a lot of more people would bike and
Was this increased walkways including bicycling?
Right.
Pedestrians, both bikes and pedestrians.
Is that assuming that people are bicycling to work? See, that's the question. What are you bicycling to?
Who are you asking?
it's a question, but I think that I heard the argument is that some people would bike commute if it was safer. And if there were expanded bike lanes, it would be safer. So they might, be able to avoid the T and commute that way.
I can see that. These people that's sending out the emails, they talking about exercise.
What?
There's
Exercise.
there's no such talk about, I need to use. So let me put it in this context. If you wanted the bicycle to work, people doing it already. They've already made that choice. I don't think that what I'm seeing based on the email traffic that people are concerned about bicycling to work. So it's more or less, let's expand the public ways for bicycles and people walking so I could keep a 6 feet parameter. Well, if I'm bicycling to work, I'm probably not going to be around a lot of people because I'm on the roads. And I'm not going to be, first of all, there should be a lot of people driving anyway. So we already have a problem. Unless you're going to work. So we know that we have an abundance of people that's on the street, regardless of what they're doing, it's not essential.
I mean, I suppose there probably are still people who are taking the T to work, and it would be nice. I mean, I think the T is a problem. T is probably the most dangerous place to be.
You know, I've looked at the T
Yeah,
and I would do another observational study.
yeah.
I would just sit and watch for an hour because, you know, I did this today. I did it over the weekend. I just watch people in their movement. And I've noticed over the last, I've been paying attention to the buses and the T, and it's pretty empty. There's not a lot of people riding the bus or the T. Now, I can tell you what I have seen and I have noticed people doing. I took an hour out of my time on Saturday. The Rhode Island has a lot of Dunkin' Donuts that I drive through. And so they closed in-house. So everybody had to be in the drive-through. There was a car in line to grab coffee at 1 o'clock in the afternoon every 1 to 2 minutes for an hour consistently. So I think that was non-essential. I couldn't see that, and it never slowed down. And so that to me, these are the problems I'm noticing a lot. So if it's happening with the car traffic, more people walking around Coolidge Corner, walking around Washington Square, Cleveland Circle, Chestnut Hill. What is going on? I mean, I thought we had an outbreak, but it doesn't appear that anybody has gotten the message. They think it's summertime. I'm on vacation.
Well, some people, I mean, it doesn't, there are, I don't know what fraction, but there are a large fraction, unfortunately, who don't take it seriously. But there are those who do too. But we definitely need to get to a larger group in many ways.
Yeah. If you think if you know, take the time. I've taken the time
I have
every
watched
day
it.
for an hour just to drive around and see what's going on, and it's disheartening. And so I hurry up and get back in my car. I put my mask on, and I drive home. I drive to the office. I drive home. Yeah, people scare me.
I mean, it's hard to know because so many more people are home. You know, and the times that I've walked into Coolidge Corner, I've had to go, for a grocery or drugstore run, or once I had to go to the bank. Um, and it's less, for those times that I went, it's less crowded than usual. And given that so many people are home, you know, I think the message is out there, but I think the problem is, it might be 80% of people are trying their best, but there's probably 20% of people who this is blowing past. I don't know how in a free society we keep doing what we can with the messaging, and I think you're on the right track.
Why couldn't yeah, messaging as well as aren't authorities in town allowed to at least remind you, Tony, that maybe you should be wearing a mask?
I think reminding is fun.
And if you got public safety, for instance, you got to get their buy-in first, but I should think that would be effective. Those guys have no idea. I don't know if you've ever talked to the cops. They have no idea about what's going on, what their own policy is.
You know, I think the transportation board is taking this up, and so maybe I think a letter from advisory council on our position might be helpful and just give them some public health thought
Yeah,
to what are they doing.
maybe.
And which is to say, I mean, the message. I mean, one of the things that I think is coming out, Peter. I think your idea is a good one. The messaging has to be relatively simple and relatively straightforward and consistent. So I think if you're saying, stay home, don't go out, or widening the sidewalk so you have more room to walk, is not particularly a consistent message. I mean, so.
Okay. So what I can do, with your help, Tony, is try to craft a letter and send it to the transportation board before they take this up.
All right, when are they taking? You know what?
Good. But
Wednesday.
All right, so we have tomorrow. Right.
Can't hear you, Tony.
Sorry?
Can't hear you for a second there, but go ahead.
So we have tomorrow to craft the letter. Okay.
Yeah, I'll start to draft something tonight once I get home.
All right.
Business.
All right, it's 7:45. Is there other business that we should talk about?
Nope.
No, that's
That's enough.
Enough.
all on the agenda.
All right. And appreciate your calling on us. Rest of the council, appreciate your willing to give of your evenings. I suspect we're going to be meeting again soon.
Yes, I think we probably should. I'm sure there'll be another hot topic next week.
All right.
Maybe we could limit it to one.
All right.
And if this night works, we could use Monday night. If not, we can look at but Tuesday night is the select board. So I think Monday night would be a good night. And if there's something that comes out of the select board meeting tomorrow, and we can definitely put on the agenda and run it by.
I like the idea of a fixed thing, Monday night at 6:30. I think we'll have plenty of business to be done
Yep.
in the next several weeks.
Okay.
I'm not able to make next Monday night, but
But you could always send a statement.
yeah.
All right.
We
Okay,
appreciate
so
your input.
it sounds like we'll be seeing each other next Monday.
Good.
In the meantime, stay safe, stay well. You've been listening in.
Stay in your house.
All right, thank you for your
Public
interest.
Health Week.
Happy Public Health Week. Okay, I'm calling the meeting to an end. Adjourn. Thank you all.